In reality, we're talking here virtually. And ironically, we're talking about the ethical issues as they pertain to the primary tool that we have for getting ourselves back in Ream Library, which I think we all want. We're talking about vaccines. I've been really struck by the range of responses to vaccines out there. Many people I know have been making a really frantic, almost part-time job trying to figure out how to get themselves vaccinated as quickly as they can. Some people, to my surprise, say they don't want it for personal reasons, unarticulated. Other people out there are even determined anti-vaxxers. We'll be interested to hear a whole range of perspectives from people on whether or not participants want to be vaccinated, but we're really interested in perspectives about what make those kinds of decisions ethical or not. We'll be interested too in a number of biological reasons as well, pharmacological, epidemiological ones that would complicate or maybe negate the need to get vaccinated for some people, or put a cautionary note to it, or maybe argue in favor of the moral necessity of getting vaccinated because of what we know scientifically. Vaccination is a personal decision, but it's also a decision that has profound impacts beyond the individual, about the need to create herd immunity, about some responsibility to protect the small number of people who, for particular medical reasons, maybe can't be vaccinated, and about the need to prevent future mutations of the virus, as we've learned in the last months, the scary possibility of that. So we want to talk about that whole range of issues, questions of access, how we prioritize who gets them first, which countries' citizens get them before others. We want to talk about the role that wealth or race or gender play in access, the role of information, disinformation, politicization. All this will be in an hour with 6 panelists, so we have a good deal we can talk about. Let me say about our format. We'll have a discussion among the fish, the 6 fish who I'll introduce in a moment, and that'll be the first half hour or so. Then we'll open the discussion out so that others can participate in it and ask questions. If you can send me a question by private chat, which is the only option we left open because it's just going to be hard to navigate that many questions and that many comments in there. If you'd like me to ask the question for you or make a comment for you, you can put that in private chat and I won't use your name, or otherwise raise your hand if you'd like to speak. I'll ask you to mute yourselves in the interim. The panel, our fish can unmute themselves because they'll be coming in and out, and just keep themselves unmuted. Our conversation is being recorded. That means it's going to be posted online for others to watch. So I'd ask you to be aware that if you do come online to talk, you'll be online forever, or however long YouTube decides to keep you up there. So let me briefly introduce our fish. Father Bill Stempsey is a Jesuit who is in the philosophy department, a medical ethicist and an MD. Jamili Shorter-Burnau is a philosopher as well, not an MD, I don't think that I know, but a philosopher. Jeff Finley is a biologist and is teaching a class on the issues related to COVID this year, co-teaching a class. And Dennis Kennedy is coincidentally co-teaching a class on the ethics involved in this. He's a political scientist. Mary Doyle Roach is chair of religious studies, Professor Mary Doyle Roach. So let's see, we talked about, I'm going to put things in a bit of a reverse order from where we were and maybe start with the allocation questions. We'll look first in the United States and after that on a global scale. So for any of the fish, I'd ask, how would you describe and assess the allocation process that's taken place in the US in the system of prioritization that we have so far? All the fish can unmute themselves and just keep themselves unmuted if you would. So. Otherwise, I'll call on someone. Bill, do you want to start?
The question was, how is the allocation system? Is that what the question is?
Yeah, the system, the process, the way we've decided, yeah. We've got the 4 stages.
Theoretically pretty good, practically really lousy. There's really a 3-phase thing. There's allocation on the federal level, and then the federal level leaves it up to the states to exactly determine how to play that out. So the federal government allocated vaccines according to population, according to various states. And then when it got there, there are a variety of ways of thinking about that. And let me just stop there because there's a lot we could talk about in that.
Anybody? Jeff, what's your perspective on that?
It's interesting, right? Because there are so many groups that have good reasons for being prioritized. I mean, I think there's broad consensus that healthcare workers and people on the front lines are a top group, but then you have so many other groups that have reasonable claims: first responders, teachers, groups that have been hit the hardest by the pandemic so far. And trying to, each state you're seeing, right, is trying to judge those things in different ways.
Mary, do you feel like they're judging them well? We have the right categories in place?
Well, I mean, I think, excuse me, I think we do. I mean, again, sort of thinking about whether or not the conversation has happened between policymakers and scientists and physicians on the ground, right? About how you kind of sort of triage, in a sense, a situation, right? And so I think having, criteria that tries to get at sort of vulnerability, right? And who's the most vulnerable to the most devastating effects, right? Is valuable. I think part of the issue is that we're not always really good at thinking about putting the most vulnerable people first. So that has us in a bit of a tailspin, and trying to figure out, we're used to figuring out those questions often in sort of resource-rich contexts. And so this is presenting itself as a very different challenge.
So typically we let the market decide, I suppose. There may be exceptions to that I'm missing. What are the ways, Jamelia, in terms of vulnerability and the market, how do you think about that we're serving? Are we serving it well, or is the market still deciding in a way?
Yes, I mean, I really enjoyed Mary's comment to this point, because of course what comes to mind is the recent controversy that's happening in Florida right now, where there's this huge discussion about the fact that it seems to be certain populations and certain zip codes, right, are having sort of the greatest access to the vaccine there, and raising these questions and concerns about how those decisions are made. And it seems to be that there are some financial interest, right, or at least what some people are alleging, in having had made that particular decision. And so I think that, again, sort of speaking here to Mary's point, which I think was so, very well put, that we are, I think, in this moment where we're having to think very seriously about what it means to, what does vulnerability mean, not just, I guess, with respect to, one sort of, access to economics and things like that, but, sort of on this more human scale, I think, when we're thinking about who was being the most hardest hit, and I guess sort of asking these questions about what are the particular ways in which we are evaluating a claim like that, so yes.
So vulnerability, when I'm thinking about it, I'm getting closer to the age where I'm vulnerable. At least I look at the little charts there, and I'm probably more vulnerable than a few people in this room, but I'm also certainly aware, if we looked at the earlier permutations, there were zip codes that had extraordinary exposure to COVID, and there are areas that don't. Whatever my age, I've kind of been able to sit home in a nice, safe house. Is there some way that Mary or Jamelia or anyone you would think about reprioritizing that? Or you say we've done a reasonably good job with that, or Bill?
Well, there are multiple reasonable ways to prioritize. There's ACIP is the Advisory Commission on Immunization Practices that the federal government has set up. And they have actually 4 ethical principles that are guiding this allocation. And the first one is to maximize benefits and minimize harms. All right, so, but to whom? They talk about the groups at highest risk, of course, but and risk is pretty easy to measure. Do you die or do you get sick? But what are the benefits we're maximizing? So, for instance, it's reasonable to think that we ought to help the least well off, so the sickest. But it's also reasonable to think that we might first help the people who stand most to benefit. So do you want to spend resources on someone who is not going to be helped, is only going to live for a short time anyway that we know of? So that is really, you can argue either way and in your priorities about making, prioritizing certain groups. But there is more than one rational way to sort that, as states have done.
Other thoughts, Mary or Jamelia, on the prioritization about?
Well, yeah, I mean, again, that's sort of, there is sort of the way of thinking about the maximization of benefit, right? Minimizing harm, and thinking about, folks who are vulnerable, and again, sort of assessing different kinds of vulnerability, or for example, children who seem to not be quite as vulnerable to the most serious effects, right, of the illness. But we're also really seeing how children's education, their well-being, is in some ways a linchpin for the economy, for all of these different kinds of things. So, and again, I guess I come back to the point where we kind of entered into a crisis without really a good way of speaking about who has sort of the greatest claim on us, and the historic sort of patterns of exclusion from benefits of healthcare and things like that. So, and that, you mentioned the market, right? That this is largely a commodified thing, right? In the United States, at the very least. It has, we shouldn't be surprised, right, that it has brought out a competitive kind of atmosphere, because that's the way that the market works in some ways, right? So, so because we have this sort of approach to the distribution of healthcare, and I find it interesting that nobody has sort of complained at all about everyone having access to this without having to pay for it. We don't look at very many, if anything, that way. And so, so I think that this is sort of why this has raised so many challenges, is because it's straining against the way we have constructed the healthcare system. And we're sort of reaping not the benefits, right? The harms of that system.
It sounds like we're willing to stretch that a little bit because we have a sense that what hurts some of us hurts all of us. So it is a public health model, probably a little bit more than we have for some of the others. I was thinking as Bill was talking, and I don't know if Jamelia, there's something you want to say. I'm interrupting. You can tell me if I am. As Bill was talking about the process, it sounds like something that was sort of done by professionals, by ethicists who are thinking through a process. So we could call it non-political in one sense. In a highly charged, politicized time in the life of our country, it sounds a little bit like it was done by I don't know, able technocrats or something. But is there still a politics to it that we should be thinking about? Is there a politics to who was on it, who they care about, how they prioritize, or do you think that they ably, as blind individual technocrats who apply rational principles, did what they need to do? Jamelia, you have a smile that will make me call on you. So,
I mean, I think that is very, this sort of, I think it does, I think speak to some of the points that Mary was bringing up. I think that what I am concerned about is that I think that this, entire crisis, and now, we're trying to roll out the vaccine and get vaccine in arms is, and I don't think I'm the first person or the only person who has said this or who believes this, that it has really sort of demonstrated these sort of deep-seated issues that we have had with who gets included and who is excluded, and how this is being done historically in medical practice. And what I hope, but I'm not seeing these conversations happening is, well, I guess my one worry is that I think that we have waited far too long to be able to remedy those disparities at this time. We're trying to get vaccines into arms, as quickly as we can so that we can get back to some sense of, what life was like in 2018, So, but the problems that we have run into, the ways in which we have excluded, groups of people, and we've just waited far too long in order to remedy those problems right now. But I think that the bigger question for us must be, how are we going to prevent these kinds of problems from reappearing in the future, right? And so, having said that, I think that it is, we would like to think that, the folks who are making these decisions are doing so in a way, with the benefit of the people in their minds. But I think that we are not divorced from the sort of context historically and so on that we have been mired in for so long. And so I think that, on the one hand, I think that we want to be able to say, and I think we have to, right, that we're doing the best that we can. But I don't think that that still means that we should turn a blind eye to the fact that, no, I mean, the decisions that we are making are still, riddled with all of these issues because of the kind of historical context that we've been dealing with, the sort of frameworks that we've been given, or that we have, sort of lived within. So these are some of the things that I worry about.
Thanks. And we'll come back later to how that historical context might feed into whether someone does take the vaccine. I think we're talking about who it's made accessible to. Maybe just one quick question I'm thinking of with Jeff before we move on to the next section is, traditionally with vaccine development, as I understand it, we have, or a lot of medical development. One of the problems has been we might test them all, say historically, we know they work on white men or something, or have we handled this well in terms of how we've tested this process so that we can be confident? I know children have not been part of the early testing process, but who's it been?
Yeah, so I know Moderna was conscious to try to make sure that the enrollment in their trials was somewhat mirroring the U.S. population in terms of diversity. The initial enrollments were skewed towards white people, and then they would keep trials open and try to pick locations to try to even those things out. So I think it's been somewhat a mixed bag. Yeah.
Okay. Maybe we can talk a little bit about the comparative rollout internationally. I travel a lot, as some of you know, for work, and some of the places I most want to be, I figure they're going to have enough vaccines by about 2080 or something like that I can get back there. I really worry about. So maybe Dennis, I'll start with you. Sort of help us think about what's the process been that decided which countries get it when and.
Yeah, so listening to the domestic conversation, it feels almost like a privileged position to be discussing benefit versus need, in a situation where vaccines are actually getting rolled out in substantial numbers, legitimately criticized. But we're at a point where the US has, I think it was something like 7.4% of the population has received at least one dose. You look at this globally, and I mean, the short answer to your question, Tom, is in fact that wealth and privilege are the single biggest determiners of where vaccine distribution is actually happening. So as of a week and a half ago, a total of 100 doses of vaccine had been administered in the poorest countries in the world. That's 95 different countries or so, 100 doses total. Whereas in the United States, we're at, 7.4. Israel is, they're up to 50% of their population has had at least one dose. They're now able to meaningfully roll back a lot of their restrictions. Life is, is returning more to normal. So essentially the situation is that the wealthiest states in the world have pre-ordered substantial numbers of vaccines. Something like 50%, 56% of vaccines are going to countries representing 16% of the global population. Canada has pre-ordered enough doses to vaccinate its population. I think it's 5 times over. The UK, 2 or 3 times over. The European Union, 3 times over. The US, I think it's 4 times over. So not only are states prioritizing their own citizens, which I think is a discussion that we could have, what are states set up to do, but they're also monopolizing, they're monopolizing the drugs, and they are squeezing out other states. And because they are bidding against one another, they're also driving the prices up. Right. So we have a situation that a lot of people have referred to as vaccine nationalism. The interest of states actually in this situation would be to cooperate, because by cooperating, you can ensure some level of access, you can diminish prices, you can create reassurance that you'll have future cooperation. There are a lot of rational reasons why we would actually want to cooperate. But states at this point in a situation of scarcity are, they're operating based on fear and worst case scenarios. And those that can get the vaccine are doing so, even if it costs, in the case of Israel, I think it was $47 per dose of vaccine, right? They're buying it up an enormous cost and making the situation ultimately worse, I would argue, for everybody down the line. So that's at least a little snippet of the international.
And is that a rationalist perspective? I mean, certainly we look at, we have to worry about variations that are coming from other parts of the world. So is it even a sensible perspective, Jeff? Or is it just foolishness?
Pick up on that word variation, right? I mean, Dennis talked about reasons why cooperation might be beneficial, but another one is, right, until we have a handle on this worldwide, exactly like you said, the virus is going to mutate in places that don't have a lot of vaccination, and that's going to travel around the globe, and it might undermine the successful vaccination in the countries that were first in line, right? And so there's another scientific reason to be worried about cooperating too.
Help me with a timeline. Are we talking about something that, I gave a very negative version of it that I'm feeling, but is this a matter of saying just wait a few months and by September everyone will be vaccinated in Canada, Britain, United States? When do you see it really opening up? So on December 31st, 2020, what percentage of the world's population might be vaccinated under some scenarios? Any guesses? Or better than guesses?
So at least in terms of the reports that I'm seeing, they're saying that for the least developed countries in the world, it could be 2024. By which point, if we follow what Jeff's saying in terms of the evolution of the pandemic, are the vaccines that are available to the least developed countries even going to protect them in any meaningful way from the disease?
And I also kind of think about the sort of, as that gap, that disparity sort of widens and widens and widens, that the sort of already existing sense from the very beginning, other forms of nationalism, right, at work, and how people perceive contagion, where it comes from, who it comes from, and how that will, sort of further isolate countries because they won't have vaccinated, so there'll be travel restrictions, and sort of all of the things that might help us to kind of build a more cooperative global structure will continue to be hampered and fueled by all sorts of racism and xenophobia and things like that.
You think it's sustainable for countries to be non-vaccine nationalists? I mean, I read that India, one of the largest producers that was supposed to be sending vaccines out everywhere, the government came back and said, slow down, you're going to keep them here until. Is it even sustainably possible? How would governments stand? And people don't always think rationally or for the common good. Shocked to know. So Dennis?
Yeah, that is one of the, I think one of the interesting things about this is that we can have this discussion about what is ethical and what are our responsibilities to others, both domestically and globally. But there are a variety of very compelling, self-interested kinds of reasons why we would want to, in fact, reinforce global cooperation. Because as we've all realized with the pandemic or with kind of the anti-trade rhetoric that's played out over the last several years, supply chains are global. We don't produce, most of what we need domestically, and even the things that we do, we rely on essential components or materials from other countries. So one of the implications of the nationalistic kinds of strategies is that the countries that we rely on for key components, or in the case of India, for producing a lot of these pharmaceuticals, might just decide, well, we're going to use what leverage we have. And even if that means sticking the wrench in global supply chains, that's the only lever that we actually have. So, yeah,
So one of our colleagues asked me to ask you anonymously, I guess a kind of market question. Isn't this, if you're a free market economist, you sort of believe that this is the way that things work well. So I'm paraphrasing that if wealthy countries buy the vaccine, that will enable greater production, that of course the countries more able to make it should make it, enable them to provide vaccine for far less money because they've recouped their investment. Is there a good market-based reason to be doing things this way, even though it has consequences in a world where everyone can't get the vaccine at the same time?
Yeah, I think the issue with letting market criteria be the only factors that really determine, medical development or provision is that it leaves enormous gaps in coverage, and then you have overspending in other places like, treatment for male pattern baldness and things along those lines. So one of the ways in which my research actually fits into this question more directly is with the work of actors like Médecins Sans Frontières, Doctors Without Borders. In the 1990s, they launched their campaign for access to essential medicines. One of the things that they were pivoting off of was what they called the 10-90 gap, which is that 10% of all medical spending on development goes to 90% of the diseases that are causing mortality in the developing world. So this tremendous gap between what's actually being spent predominantly on issues that affect the global north and the reality that the pain and the suffering is happening and not being treated in the global south. And then what happens here again from a instrumental perspective is that when something then happens like 2014, the West African Ebola crisis, at that point in time, there were not effective tests or treatments or vaccines for Ebola. And then you have something that, to be clear, predominantly affects West Africa, but finally becomes understood as a threat to global health security. And then at that point, when it's a bit too late, you start having substantial resources put into it. So, thinking long term, there does need to be more preparedness. And it does appear that the market on its own is not going to do this. And with COVID-19, it is not the market on its own that's doing this. These have been pre-ordered and pre-funded, whether or not they would actually work in most cases by Western governments. So, it's not the market that's ultimately going to provide the benefits to Pfizer or Moderna or AstraZeneca. It's states that have pre-ordered large numbers of these vaccines. So this is not even a situation where the market's doing the predominant work here.
Great. I think there are things we can continue with this, but I want to make sure so we can open it to the fish. I want to go to that question, the third question that we talked about obligation to receive the vaccine. And in some ways, I conceived of this after some of you saw the fishbowl where students were interviewing Dr. Tony Fauci, and one of the students asked, is there a moral obligation to take the vaccine? And Dr. Fauci said, well, he hesitated, and then he said, my wife, who's an ethicist, would tell me I can't say yes. There is no moral obligation because you're putting something inside of you. It may affect you and the like negatively. So he kind of hesitated with it, but left us, no moral obligation, which raised all sorts of questions for me about herd immunity that we can get in. Some of you may have seen the other day that Pope Francis asked about it. He's been a big encourager, but the other day, America Magazine reports that the Vatican told its employees to get a COVID vaccine or risk getting fired. Now, those are pretty disparate conclusions. So ironically, the scientists left it to public personal opinion, and the religion guy made it a probably science-based one, I would argue, but we can play with that a little bit. So how do we unpack that divergence of views? Is there an obligation, a responsibility to receive it? How do we think about herd immunity in that context? Anybody want to jump in I'll ask you all where you stand about that before we're done. So the fish at least, but Bill, maybe do you want to start with that?
Yeah, well, the real principle involved here is the principle of the common good, which doesn't play well in our society, a liberal, individualistic kind of a society. But that is what a lot of people have talked about. In fact, the World Health Organization has a value framework for vaccine allocation, and they talk about not only national equity, which is what we're talking about here, but also global equity. So those countries that are in the worst kind of a shape and may need the help, they need some special attention. Um, so as far as the the kind of civil discourse in the United States goes, we don't have much of a worldview, but we do know that it's in our self-interest if we promote this kind of a global equity that the World Health Organization urges. So I think the question was, do we have an obligation, moral
Or
obligation?
moral responsibility or something,
Moral
however you would
responsibility.
frame it, to
Well,
get the vaccine.
Well, the ethicists, some of the people who are ethicists never want to tell you what's right or wrong, and I agree with that in a way. But I would say yes, with exceptions. Right?
Okay.
In fact, we require our students to have certain vaccinations right now. Right, measles, mumps, rubella. We require everybody on campus now to have the influenza vaccination this year. Right, so this is not something new. There are, of course, there are people who have allergies to components of the vaccines. And of course, you can't require them.
Right.
There may be other valid reasons as well, but in general, I think we do have a moral responsibility to promote the common good. And that goes beyond our campus. It goes to our city, to the community, and to the world.
Yeah, and just to kind of, build on that a bit, again, it's sort of this kind of larger framework as, Bill said, we don't think in common good terms very often. And, the sense in which I think even when you're thinking about just sort of vaccines, or even just sort of ethical decision-making in a medical context generally, right, is that our sort of the thrust of our patients' rights movement, right, has been the right to refuse a treatment, right? It hasn't been the right to actually obtain one, right? And so, and again, this sort of is the 1090 gap, right? The sense that for most of the world, patients' rights are the part Paul Farmer says, the right to be somebody's patient in the first place, right? That's the first right, but we don't sort of frame that in that way. And so we also think about vaccines primarily. I mean, I don't know if there's been a study on this, but sort of my impression when I hear, people talking about sort of refusing vaccines for their children and things like that, right? That there's a sense in which we think about vaccine as a sort of merely a personal protection from illness, right? So linking this to something like herd immunity. Well, no, I get the vaccine. Does it protect me? Yes, but the key thing is that it helps sort of protect even more vulnerable people if I get vaccinated, and a certain number of people get vaccinated, right? So, I think about thinking about the vaccine as a sort of, again, a public health measure. I would agree that I think for many of us who sort of enjoy sort of overall good health and have access, right? I think there's a sense in which the sort of the burden falls on us to have a reason to refuse it, right? But to be aware that the decision, right, is always really context dependent, right? Because for some people, it sort of will not, be necessarily the right thing to do. And for those, folks who are uncertain, right? The more of us, who can, again, sort of build that immunity, then, hopefully, people will accept it. But the reasons for not there are a lot. And as you pointed out, there are some of them, again, that sort of strike, you said, sort of as irrational. I think that making an informed decision is really important. But I would also kind of caution against some of the way in which we frame this decision-making as irrational, particularly when we look at the intersection of vaccine refusal with race and class. So sort of anti-vaxxers, like, you know, that terrible sort of kind of rhetoric, right? But folks tended to be highly educated, white, and affluent because they thought they could insulate themselves from those diseases without taking the risk or sharing the risk, as minimal as it is, of vaccination, with the confidence that if their kids got chickenpox, they wouldn't die of it, right? Not realizing that that's not the case for everybody. So, so for me, that's, you know, another, you know, piece of it. If we use sort of an irrational kind of model, it does not take into consideration that people who do not trust the medical establishment have serious, real reasons for not trusting it. And we have to really confront that and not just sort of say, it's irrational that you think, right, that that you might be being exploited, because the healthcare system has never exploited anybody. I mean, simply not, you know, simply not true. So to really kind of honor where people are at with their reasons, I think is also important.
Where does that leave you when you're talking to them? I can honor their reasons, or if I would say how they feel about it. Where does that leave you, though, in terms of?
I think the burden is on, I don't know, the institute, you know, healthcare, the establishment, or sort of the people who have the access. The burden, I think, is on us to earn that trust, and not simply demand it. I think it's also, you know, when we switch, we move quickly, and we do this with students. We do this with a lot of folks, right? To sort of move quickly to say, well, we will mandate it. We will simply force you to do it. Well, that gets everybody's hackles up, right? Is that what we needed to do, right? So even things that have happened before about mandatory testing for HIV and things like that, some of that controversy could have been avoided if they simply talked to people and asked them and explained what was happening and, you know, what was going on, without making particular sort of kind of legislating, right, around it in a way that made people feel like they were being, you know, not treated very well in that system. So,
Jamelia, I think you were going to say something. Or
It's concerns like these that make it very hard for me to be able to say with any sort of confidence that we, you know, one has a moral obligation to take the vaccine. You know, on the one hand, I feel very strongly that everyone should feel as though they ought to take the vaccine for some of the reasons that have been, you know, named, and I'm pretty sure will continue to be said. Reasons that I also believe in as well, in terms of, you know, as Bill was saying, for the common good. But what I'm very much concerned about is that if you have populations who, you know, have legitimate worries based on, you know, certain medical, you know, or healthcare experiences that they have had or that they have experienced as a group of people historically, or there may be religious reasons or, you know, other reasons why they may not want to take the vaccine, that my concern is that there's a sense in which a claim such as, well, you are morally obligated to take the vaccine, can then turn into a sort of moral paradigm that we're, you know, imposing upon these people, right? You know, so what I'm saying is that it can raise these sorts of concerns that, you know, we often see in philosophy, in which there are particular ways in which people are, you know, in which this is an ethical, you know, sort of way of living, and this is an unethical way of living. And so if you don't fit within this model, then, you know, you are selfish, or there's some other kinds of issues that you have, which may not necessarily be true. And so I think that the question for me is, how do we, you know, are we able to arrive at this claim that one has an ethical, that one is morally obligated to take the vaccine? How are we able to arrive at that sort of conclusion and make sure that we do so in a way that does not end up upending all of the effort that we believe ourselves to have, worked for in terms of trying to make our world and our society, more equitable. Perhaps there is a different kind of language that's actually more fitting, that's maybe not sort of moral based, right? But rather is sort of based on this idea that, this is the right thing for us to do for our community because we're all human beings or something along those lines. Because again, my worry is that if we just sort of in a blanket way say, well, you're morally obligated, but not taking into consideration some of these other frameworks and histories that we have actually coddled and protected for so long, that we don't have the time to dismantle right now, but we certainly need to, that it may end up actually creating some other problems.
Jeff, are there medical reasons why one should think one should be hesitant to say that? Back at the time when we asked Dr. Fauci the question, things hadn't been through FDA review and some of that stuff yet. After they've been through that and all, are you still as hesitant?
So I think what Jamelia just explained there matches my views very well, right? And what's striking me about this is that the interests line up. My personal interest in getting on the science is that this vaccine is going to help me. It's going to help members of my immediate family or people I see who may not be able to access the vaccine as quickly, and it's also going to help the community, right? And so all three of those are pointing in the same direction. And so I think if we can appeal to people, either their self-interest or their interest in protecting loved ones or their interest in helping community, those are all beneficial. But I also agree that it's important to listen to the reasons why people are hesitant or not wanting to, and try to address those directly. In terms of mandating the vaccine, right? Right now, even institutions that would and have mandated other vaccines aren't doing it yet because it hasn't been all the way through the full FDA approval process, right? Right now, these vaccines are authorized under emergency use authorization. And so, right now, UMass Hospital can't require its doctors to take the vaccine, even though they're in a high-risk situation and also with high-risk patients, right? Because they will, I think, as soon as it's FDA approved, but we're not at that point yet. And other groups are the Army, right, is another group that normally would have a lot of authority to be able to do that and doesn't feel like they can. Yeah, so I think while we are further than we were when we talked with Dr. Fauci in the fall, we're not as far as even groups that would have maybe some of the strongest claims for mandating feel they need to be.
Okay, there's a lot more I can talk about with that. There are a bunch of questions in here. I will assume that the questions are put in anonymously and anyone can raise a hand. Someone asked, would imposing any long-term requirements about indefinite mask use or travel restrictions on individuals who choose not to or are unable to take the vaccine, would that be ethical? Something different about putting a mask on than or not being able to travel than taking a vaccine that you want to think of differently, or does it raise the same set of issues?
I will just say that I do not think that mask wearing raises the same set of issues, right? As a vaccine, I think that has not been an unreasonable infringement on anybody's freedom, or anything like that. The stay-at-home orders, which you hope are not sort of, lasting, they've lasted a really long time. But I think you have to be able to, part of the tradition, right, is in ethical decision making is sort of proportionality, right? So how do you think about sort of what the risks and the benefits of something are? Again, I think we're hoping that vaccine, right, is also going to tilt right in favor when all of the studies are in, right, as being a very low risk with some, for most people, a minor annoyance, right, and so I think that they are really different things, but another level would be some of the, I guess, the experimental treatments, and things like that are in a different sort of stage of development and research and things like that. So yeah, I think you do have to be able to sort of to again tell the difference, right, between things and work on what your proportionate reason is.
I have a question about the vaccine, what you think about vaccine passports and how that relates to all this, what they'll play in the world in the next role in the world in the next few years. So one can imagine, I'm extrapolating from the question, but a kind of brave new world of people being able to travel and do things of greater inequality depending on who happens. So perhaps we'll say, you know what, if you haven't had the vaccine and you don't have a vaccine passport, maybe you can't work here, you can't have a job here, you can't whatever. Or we'll ask people to prove that. And the government may be able to do one thing, but private entities can probably do another thing. They can say, you can't get on my plane or come to work in my place or something like that. Any thoughts on how that's going to change everything?
I would
Dennis.
say that the last two questions in my mind do blend together in a couple of those ways, because a lot of the discussions we're having are about what public authorities, ideally elected authorities, should be deciding and what is ethical or what is appropriate. But in practice, you know, we do seem to, in these polarized times, increasingly punt these kinds of questions to the private sector and rely on corporations to, in some sense, do the ethical dirty work. So it's plausible that we might see, say, vaccine passports. Even in the US, I think it was a few days ago, Vermont just waived its travel restrictions if you have proof that you've had the vaccines. Right. That seems likely on a governmental level, but maybe not the kinds of draconian policies in terms of maybe mandating vaccines, although Indonesia has floated that idea. At the same time, I think we can see corporations, airlines, you know, responding to market pressures where people say, I'm not going to be comfortable flying on an airplane unless I know that people are A, wearing masks, or B, ideally are vaccinated, that are going to be the ones that step up. And maybe we'll end up at the same end point where we have a, you know, a de facto vaccine requirement, but it's not governments necessarily imposing that, it's corporations. And that raises some questions then about, how do we hold these actors to account without the democratic kinds of input into that process?
One of our colleagues points out, as I have one too, for years I've carried an international certificate of vaccination approved by the World Health Organization, used to required for admission in certain countries. My yellow card is in my bag behind me. What's different about this?
I would say nothing. It's a well-recognized public health practice, and we've been doing it for years.
I would say nothing in the long term. In the short term, where we are talking about a situation where the highly developed countries will have access, their populations will have access to the vaccine, possibly years before the least developed. That's, to my mind, that is the biggest issue with that, is it will just reinforce these divisions between global north and global south. Once everybody has access, then I think that it is more tenable to have that kind of requirement.
So this may be a hard one to answer, but one person wants to know, why are students and teachers not a top priority for vaccinations? Is it considered to be morally wrong to throw students and teachers back into school without having herd immunity? Anonymous asks. Any thoughts?
Well, you know, children, for all of the rhetoric, are not usually a very high priority when push comes to shove. And the people who are responsible for the care of very young children are not a priority, right? And I think that, you know, again, that's the care of young children is not exclusively, right, but highly gendered. So there are just so many underlying questions here that, you know, we're not, right, surprised. So, you know, and even
when you say it's highly gendered, you're suggesting because most teachers are women, there's lower priority to concretize that?
Sure. Yeah, I think, yes, I am saying that.
Okay.
I'm saying that. And
just to be clearer, yeah.
Yeah, yeah. You know, so I think that that's, you know, we can talk about children, we can talk about those things, but they have the very little protection, right? You know, and, you know, even in the beginning, right, of the pandemic, and you could sort of really see this coming, right? That there are, every night, to make us feel better on the news, let's highlight some remarkable thing that a teacher is doing, having a parade through the neighborhood, using her, I'm going to keep saying that, own resources, right? And gathering to kind of keep doing the academic work, but also doing the emotional and care labor for their students. And we glorify this. We glorify that for first responders, for nurses. Again, nursing, highly gendered and sort of, and I think, intimate bodily care of elders, right, and children is, the social status of that is not very high. And so, so even in all these things that we were sort of celebrating, I'm watching that and saying, yes. And as soon as the teachers union says, resists some plan, they're going to be sort of cast as kind of undermining, so everybody who is celebrating people all of a sudden is, feel like they're coming up at one another. So, I do think that children are really important. I think their teachers are really important. I think that makes a lot of sense to prioritize them. As Bill is saying, the common good and sort of really how much we all depend on one another for the care of children in our own families and how much we're responsible for the care of other people's children, but the work that goes into that. And so I think that is a reasonable priority, partly because of the ripple effect of it. And I'm thinking primarily about K-12 students, right? Because I think for college and university, where again, we can transmit things really. So I see some of the arguments why we would be kind of included in there and college students included in there. But I think the sort of the risks to young children in terms of the disruption of their education and psychosocial development is quite different than what it generally is, at the college level.
I have other questions. I will say to people, the other people who are not in the fish, who are not the fish, that this is a time you can come in not only with questions, but with statements. If you have a statement that you want to make, I'm happy to make those, or you can come in and raise your hand to do that. Question: is there enough investment in the immunity of people who? I'm sorry, enough investment in understanding the immunity of people who have already been exposed to the virus? Given the scale of the pandemic, does this knowledge not hold the potential to significantly reduce the need for vaccine doses and thus increase the effectiveness of distribution? Sounds like a Jeff or Bill question, but.
Yeah, so I know there's been a lot of discussion lately about the idea that if you've already had COVID-19, right, you maybe only need one dose of the vaccine, kind of remind your immune system what it looked like. I think, I know there are certainly studies. I mean, I think there's a lot of studies now using plasma from patients who have recovered to see how well do their antibodies deal with, for example, these new variants. So I think there is research attention being paid there. I think it just is going to take some time to have those complete to know what the right sort of public health recommendation is. But I think there's attention to that. I think attention to long COVID is another issue that needs persistent study and realizing there are patients who don't fully recover for many months and what that's going to do. That's another issue that needs attention to.
Yeah.
Right. Go ahead.
I think that a lot of people don't quite understand how science works, and they think, you read one study and here's the truth. But as Dr. Fauci keeps telling everybody, there's a lot of stuff we just don't know, and we're gathering information, and this is all happening very fast. So we really have to be patient and admit that we don't know what we don't know, or we risk setting up these kinds of conflicts where, oh, you said this and now you don't. Now you're saying something different, so we can't trust you. But science develops gradually. So there are loads of people working on this, and so to that question, I think we just don't know enough to really give an answer to it.
Let me combine a couple of questions. How does and should the distribution of vaccine treat undocumented immigrants and refugees over citizens? And what are your thoughts around prisoners receiving the vaccine as a priority? Maybe I'll put that to Jamelia and Mary, because you have especially talked about the vulnerable. But someone can be against that. Go ahead.
Well, this is where I think that the question of equality does come into play. Of course, we know that this is a sort of a loaded term and a loaded idea, and I don't think it's very easy to enact in sort of the practical sense. But I think that we do need to spend some time thinking about, whether we will be able to do this perfectly or not. What does it look? What would it look like to, sort of consider each of these different populations and the different needs that they may have, and to try to, in some way, make sure that we are able to distribute to those populations as well, because especially when I think about refugees and undocumented people. They're a part of our society as well, and so I don't, the coronavirus does not make a distinction, amongst people based on their status. And so, there has to be a way, but I understand that because of some of the other, trappings that come with being able to, document who gets these vaccines with respect to insurance payments and things like that. My hope is that we are also working on some ways to get around some of that red tape, so that everyone who's able, who's willing, and who needs the vaccine is able to get one. And certainly, I think with the prison population, it's just for obvious reasons, due to probably, I would assume, the inability to social distance and things like that. Perhaps, for those reasons, those kinds of populations should actually be a little bit higher on our priority list. But again, I'm concerned that some of the ways in which we're making some of these decisions are based on finances, and again, based on some of these frameworks and historical, ideals that we have, racism, xenophobia, and so on and so forth, that are guiding our decisions, as opposed to really sort of looking at this in a more holistic way.
Yeah, I would agree with that, and certainly having, folks higher up on the list, right? And, as Jamelia has said, and it's so important, that we can't sort of solve longstanding patterns of injustice sort of kind of in the moment, but we have to actually be working on that, parallel track. And so as a Christian ethicist who works in the Catholic moral tradition, absolutely, right, that your citizenship status does not impact, right, should not impact your access to care, and that even people who are imprisoned for whatever reason, caged for whatever reason, right, are not beyond the reach of the Christian community, and have intrinsic human dignity, right? And so, and to avoid, right, a sense in which, and this is really dangerous when it intersects again along sort of other lines, right, where we decide who's worthy of the vaccine, right? And that's a very different kind of question. And then the people who have the vaccine, it sort of fuels, right, their own sense of moral superiority, and that's based on race and gender and social class and things like that. So, so working on prioritizing those folks, and immigration policy and prison abolition all at the same time.
We're essentially at time, but I'm going to ask each of the fish to tell me if you could, in sort of speak, whether in a word or two or a sentence at most, if you were asked what your sort of core irreducible value is behind it, your one non-reducible thing at the heart of your argument, both about distribution ethics and then about obligation, responsibility, encouragement to take the vaccine or not. What determines that? Mary's shaking her head, so I'll let her go first. So I see the ones looking at the ceiling, I won't call on right away. So
that, the absolute intrinsic dignity of every person, and that is a person who is profoundly relational and social, right, with an obligation to self-care, to the care of faithfulness to friends and family, and commitment to the common good and justice.
Dennis?
Yeah, when I was thinking about that, I was going to say obligation as well, but I would also say the idea of common humanity, which is that, what we should be compelled to do in a situation of pandemic is to understand that we are part of and we are, irreducibly affected by what's happening to other people. And so that should be an opportunity for us to break outside of what our conventional mindsets are and to recognize that we are, we're all in this together, and someone's suffering is like our own suffering. So that should be an opportunity to break down some of these barriers. So I would say common humanity.
Jeff?
I think I'll give the scientific answer and say herd immunity, right? That's going to be the fastest way for everyone to get out of the situation that we find ourselves in. So,
Jamelia?
I'm sort of very similar to Dennis and Mary, it's about caring for others, that if everyone takes the vaccine who is physically able to, again, there may be, people with allergies and so on who cannot, that we're doing so because we care, we want to protect not only ourselves, but other people around us.
Great. And Bill?
The common good is probably the overarching thing, but I didn't want to leave you with the idea that I want to be a dictator about this, because I do recognize all the complexities, especially about the distrust of some groups for very good reasons. And I think what I would advocate is persuasion rather than coercion, and that's gonna take a different approach to educating people. It's not just gathering the facts, but to get people of trust to talk about the people who don't trust. I think I messed that up. To get the group that doesn't trust, and to get someone that group trusts to talk with them. Okay.
Great. Thank you to everybody. I appreciated that. I learned a lot, and I appreciate the nuances and the passion that you bring to the issue. And thanks to everyone else for joining us today.